Good evening to all. I hope my audio is fine. So today's session will be on amyl nitrosum. Yes, chemically it is C5H12NO2. Coming to the old method, it should belong to 6A method, and new method has a drug strength of 1/10. Just pay a little on the chemical and physical properties. It's a transparent yellowish fluid. The odor is ethereal or a fruity odor. It has a pungent or aromatic taste. It is volatile even in low temperature, and it is very inflammable liquid. Okay, and it slowly decomposes on exposure to air as well as light. So that being said, we have to go for the homeopathic part. Constitution. We usually say amyl nitrosum as a female because it has more of a female complaint, especially to the climacteric age group. Okay, for nervous, sensitive, plethoric women during or after the menopause. Okay, so here itself we already have mentioned the you know yeah. So that is there. The menopausal complaints is already addressed here. Anxiety as if something might happen and must have fresh air. So this is a remedy that craves fresh air. Okay. Yeah. So the picture says the rest of it. Okay. So the lady is on a open area and she likes that very much. Okay. Physical generals, yes, I think I can also relate to the photo that is depicted here, as one person is yawning here. It always happens, right, when we try to study and you tend to get sleepy. Okay, so that's why, and that symptom is there in this remedy. Profound and repeated yawning, also shared by Calicarb, and yes, amyl nitrosum has that. So don't worry, don't think that you people are Calicarb or amyl nitrosum. No, that is very normal situation, especially when you sit for study. Okay. Yeah. So so it is often palliative in incurable cases, very important as regards to euthanasia. Okay, euthanasia is mercy killing. Alright, so that is there. In incurable cases, it acts like a palliative. Again, when you go for the relations part, you will see what in palliation what all it does. Okay, creates fresh air, opens clothing, removes bed covering, and opens window in the coldest weather. Okay, so you have in the brackets you have all the hot remedies mentioned like arsenonitricum, lactic acid, sulfur. Okay, so you also have to remember that amyl nitrosum also comes to that group of the remedy. Pardon that background noise. Sorry. So yeah, amyl nitrosum is one such remedy that craves fresh air. Okay. Constant stretching for hours, impossibly to satisfy the desire, would seize the bed and call for help to stretch. Okay, so this remedy has that level of desire to stretch, and it's pretty much impossible to satisfy the desire. So I think everybody will be. I mean, I personally feel that majority of the people will be liking to stretch. After getting up, you have this kind of, what to say, that desire will be there. I don't know how to explain that, but then yeah, that is there. Okay, and so I think we have so many relatable symptoms for amyl nitrosum. One is yawning, and the other is stretching desire. So that apart, you also have seasickness. Okay, seasickness is also there. So yeah, the lady is stretching in the first photo, and the other speaks of the seasickness. Okay. Yeah, the quick question here is delirium begins with paroxysm of yawning. Uh, this is a symptom that we have already discussed. It's one of the remedies that we have already finished. It is none other than the agaricus. Kindly pardon, 1 minute. Yeah, sorry for the disturbance. Yeah, sorry. So delirium begins with paroxysm of yawning. That is a remedy that we have already discussed. That is nothing but agaricus. Okay. hemicrania, especially when the afflicted side is pallid. Okay, you have traumatic conditions also covered here. Again, this being a vasodilator, you can always expect, all these hemorrhagic conditions that can be, dealt by amyl nitrosum. Face flushes at the slightest emotion. Okay. The other remedies are kuka and ferrum. Now, ferrum also have this description where white parts become red and it alternates also. Okay, so such kind of descriptions are there. Speaks of the flushing. Okay, the intense, rush of blood to those areas. See, the next point is blushing, chronic or acute. I don't think so. That's a very important remedy. But what I mean to say is that you feel the active hyperemia that is occurring in this remedy throughout. Okay. Neck has a particular symptom. Collar seems too tight, must loosen it. Okay, so this is a very famous symptom of laxus exactly. And then you also have other remedies like amyl nitrosum, sepia. Alright. Now let us break down the areas. So great sensitiveness to touch, especially the throat, stomach and abdomen is for the laxus. Okay. And what it does, it makes her nervous. Okay. So sensitivity to touch and that makes her nervous is laxus. Okay. Please note the areas throat and abdomen. Covering of neck felt too tight. The description is given in sepia, also giving a mention for laxus. Now we also have other type of sensitivity to touch, but here the reason is different. The sensitivity to touch due to soreness. It is already mentioned in I think it's in amyl nitrosum itself, and that is apis as well as belladonna. You have fear of being touched, especially in injury cases. You have arnica. Cannot bear to be touched, especially on the feet. So that is calicar, which is again very easy also. There is nothing much to remember. This all are keynote symptoms. Okay. Sensitiveness of the vertebra, sits sideways in a chair. Now see, I am sitting in a chair. So I am not having sensitivity to towards my spine. So here, even though it's vertebrae, what you can remember is you have the sensitivity of the back region, and the person is reluctant to have contact in that region. So he sits sideways. Okay. So what I mean to say is it's a very important symptom. Especially what you have to remember is pteridion. In brackets, there is a mention for chinnum sulf. Now, speaking of sensitivity, spider group is very much sensitive to almost every type of, stimuli. Okay. Also, tarantula has sensitivity of spine, but that causes pain in chest. Okay, spasmodic pain in chest and cardiac region, that is shown by tarantula. Even agaricus has great sensitivity of spine. Okay, so all these can be related. If you go to hemorrhoids, sensitivity to touch, even the toilet sheet is very sensitive. That is a description given for muriatic acid. Okay, so there are a lot of remedies that has problem with touch. So you can try relating like that. Okay. In female, you have again the mention of climacteric headache and flushes of heat with anxiety and palpitation. Now we already said that all these things are common symptoms of climacteric age group. There is heat flushes, there is headache, there is anxiety, there is palpitation. So all these cover all the menopausal syndrome features, and thus it is also applicable in amyl nitrosum. So you have various remedies like sanguinaria, you have laxus, sulfur, all having problems with menopause. Okay, so all these can be compared here. In cardiovascular system, you have rapid dilation of the arteries, and it accelerates the pulse. it accelerates, but then later it weakens and retards the pulse. Okay. Initially there is an accelerated pulse, but later on it decreases the pulse. Okay. Intense surging of blood to face and head, also shared by belladonna as well as glonoine. Angina pectoris, tumultuous action of heart, intense throbbing and intense throbbing of heart as well as carotids, also seen in glonoine. Okay. So all these speaks of the rush of blood to heart, your head, carotids, all these things are there. Okay, there is enough throbbing there. Okay, there is dilatation of arteries. So what is amyl nitrosum? If you don't remember anything, please remember this nitroglycerin where you have some sublingual nitrate. You remember, I think, when somebody gets angina, people used to keep something under the tongue. What is that? That is amyl nitrosum. So I think from that, I think it should be pretty easy to relate that it dilates the artery. Now, if it's dilating the coronary artery, you should be understanding the level of potential of this remedy. Okay. To the CNS part, you have puerperal convulsions immediately after delivery, an important symptom, and it often relieves temporary epileptic convulsions. Okay. In fever, you have intense flushings as well as sweating. Flushing starts from face, stomach, various parts of the body, followed by sweating, often hot. The sweat is described as hot rather than cold perspiration, like there are shock. Okay, so it's not going to a shock type of thing. Let us go there. So followed by sweating, often hot, profusely, abruptly limited, and then parts below are icy cold. So wherever there is sweating, it is hot, and then if it's not there, it is going to be icy cold, and obviously followed by great prostration. Abnormal sweat after influenza. So all these things or the description should make you understand that there is enough perspiration during fever time. Okay. Modalities, there is aggravation for mental and physical exertion. In relation, you have similarity to bell, cactus, coca, ferrum, glonoine, laxus. All these have this hyperemia. That is why these things are coming. And acts promptly by inhalation. Yeah, this is one remedy that you can inhale, and it resuscitates persons sinking under anesthetics. So somebody is unconscious, you always the first remedy that comes to mind for inhalation is amyl nitrosum. Drug chiefly palliative must be repeated as patient becomes accustomed to it. Curative in the stronger higher potencies. Okay, the cure more frequently depends on the strength of the potency. Yeah, great. For palliations in all conditions where the blood vessels are spasmodically contracted, as in angina, epileptic seizure, megalim, accompanied by cold pallor. Okay, I think everything speaks of the constriction. So wherever you see constriction, you can think of amyl nitrosum. That's all we have to take from here. The question that you have to know here is which of the following is not true regarding amyl nitrosum? The answer is in the first option itself. Air sickness. This remedy craves air, so there is no problem with air. It is for seasickness. The other remedy symptoms are true. Repeated yawning is there. For cardiac also it's there. Puerperal convulsions is there. Desire to stress violently it is there. So the odd one out is air sickness. Okay. And then you have throbbing of carotids is seen in all except glonoine, it is there, belladonna, it's there, amyl nitrosum, it is there. The odd one is millefolium. It's not millefolium, it's melilotus. Okay, so go for belladonna description. Okay, then you will find there is melilotus mentioned in the bracket. Okay, so it is not millefolium, it is melilotus. So if millefolium is there in the option, then that becomes the odd one out. Okay. If the option was melilotus, all of the four are correct. Okay. So all of the four shares throbbing of carotids. That's what I mean to say. Okay. So I think that's it.